Hi everyone, and welcome back to sqadia.com. Now, before we get into the title of this video, I cannot stress enough how important this topic is for your medical exams as well as for your boards. Meningitis comes up every step of the way, and the CSF findings are something which you are expected to know, since treating meningitis as early as possible is the key factor. But let's review the meninges really quickly before getting into any details. The dura mater lies beneath the skull, and beneath the dura mater, we have the arachnoid mater and the pia mater. The arachnoid and the pia mater are both called leptomeninges. All three layers are collectively called the meninges. Now, meningitis is the inflammation of the leptomeninges, which again refer to the arachnoid and pia mater. This is usually caused by an infection, so the cause can be bacterial, viral, or even fungal. Symptoms of meningitis include fever, owing to the infection, headaches, which is due to the inflammation itself, and also photophobia. Other than these, there is usually nuchal rigidity, which is the pain that is felt at the back of the neck when moved. It is also referred to as neck rigidity at times, and this is a major symptom appearing in over 70% of patients of meningitis, and it occurs because of inflammation of the tissue encasing the brain and spinal cord. The increased pressure due to the inflammation renders the neck muscles stiff, and that is why it is painful to move the neck. In the recent past, there were some signs that were looked at in order to make the diagnosis clearer, such as Kernig sign, which is when a patient lies flat and has thighs bent at the hip and knees at 90 degrees, and when you try to straighten the knee, it elicits pain and is resisted. Another sign is the Brudzinski sign, in which the patient lies flat and you lift their head off the table and the patient lifts their legs up involuntarily. These are largely historical now, as we move on to spinal tap if we suspect meningitis at all. Now, in spinal tap or lumbar puncture, we are taking out the cerebrospinal fluid from the subarachnoid space. We do this by landmarking the iliac crest and locating between L3 and L4 or L4 and L5. L4 and L5 is the more common site since the space between the two is largest and relatively easier to insert the needle into. Now, you have to know what layers you pass the needle through. So it's the skin, then the ligaments, then the dura mater, and then the arachnoid mater. Make sure you remember that you do not cross the pia mater, because you want to enter the subarachnoid space. Now, when we suspect meningitis, we want to start the treatment right away to avoid complications of meningitis, which are death, which can be by brain herniation, circulatory failure, or intractable seizures, hydrocephalus, which is the buildup of fluid in the cavities or the ventricles deep within the brain. The excess fluid increases the size of the ventricles and puts the pressure on the brain. Hearing loss, which can be by infection spreading to the cochlea or inflammation of the auditory nerve itself, or seizures, which may result from swelling and pressure in the brain, as well as the infection itself in the meninges. Alright, so now that we have a better understanding of where the meninges are and what meningitis is, keep watching the next section where we talk about the CSF findings.